Hello, I'm Dr. T, general practitioner from Sweden. I've encountered a lot of patients with a condition called dementia. So, what is it? How can you cure it, or is there a cure? To understand this condition, one must understand how the brain functions. Of course, not in the minimal detail, but to get a rough idea how the brain functions so that you know later when it goes wrong. Normally, the brain has 100 billion brain cells when a child enters the earth, and during the time you tend to lose them. So, to maintain the brain function, you have to build connections with different nerve cells and build an intricate network to get the signal, to get what you need. I mean, say thoughts, to build a thought, to get a muscle movement, or to feel, say, sense. You have to build these complicated nerve connections from the nerves that you still have. So when you're around 8 years old, nearly 50% of your nerve cells in the frontal part and also the temporal part of your cerebral cortex have been lost. So this is a normal development when you get old. The brain starts to function a bit slower. You tend to have difficulty in learning or memorizing new information. You have difficulty in adjusting yourself or adapting to newly changed conditions, and your brain starts to slowly work in a very slow pace, you could say, compared to before. I mean, to calculate it takes a longer time. To memorize something takes a longer time compared to when you are young. So that's the reason why, for example, your grandmother has difficulty in using the mobile phone or the computer. You might yourself think that, oh man, come on, grandma, this is very easy. You just need to press this button. You just need to use it in this way, send photos or FaceTime. You can connect with people when you are still at home. But for them, it's a very total new thing. For when they were young, they didn't have those instruments, and nerve connections that they have doesn't have anything regarding computers, doesn't have anything regarding mobile phones. For them to call someone, you need to either go to a telephone booth or you need to go to the hand telephone and call them. Not that you can call anytime, not that you can even see the person you talk with. It's a totally new thing. So their brain has to find connections from the connections they already have and try to connect them so that they can get a bit of picture of, okay, what is a mobile phone, what is a computer, and how to use it. But eventually with time they tend to learn it. They tend to be able to use it, right? So is this dementia? No, it's a condition called mild cognitive impairment. For a shortened form, it's called for MCI. And this is a normal process when aging, where your brain functions a little bit slower. So then what is dementia? Dementia is when your brain function is decreased in a much higher rate compared to MCI, or mild cognitive impairment. So if you take a diagram as I'm shown now, the normal brain function is like this, and then when you get older and older, it starts to go to a downward curve. But when you have dementia, the downward curve is much steeper compared to an MCI. This is what dementia is. That means the brain function decreases in a much higher rate. And dementia comes from two words in Latin, is de and then mentia. De is loss of, and mentia is understanding. So if you combine those two, it is loss of understanding, and that's what dementia is. So the brain functions of the brain has two sources of memory, a long term and a short term. So if you take first the short term, it's called the working memory. And the working memory is used to have memory for small things during a small period of time. So say, for example, to remember where you put your pen when you are writing, or when you are reading a sentence, to remember what you read in the first part of the sentence. I mean, if you're cooking, to remember if you put salt in it, or if you put the chicken in it. In a garage, to remember where did you put your screwdriver. So this working memory is that you keep things in your memory for a very short period of time when you work with it, and then afterwards it is erased, so then you don't remember. And then the second one, the long-term memory, constitutes of 4 types of memories: the procedural, the perceptual, episodic, and semantic memory. So if we start with the procedural memory, the memory of muscle movements or behaviors, you could say. So for example, how you cycle, how you walk, how you cook something is in this procedural memory. How you tie a shoelace, for example, or play instruments. Those are memories of specific motor functions you remember, you learn in and put it in your brain. So that's called the procedural memory. The second one is perceptual memory, the center where you recognize what things and faces are called or named. So for example, how your grandmother looks like, or how your friend looks like, or how your relative looks like, or your teacher looks like. So this is called perceptual memory. Or I mean, not just people, also stuffs, like, okay, how does a football look like? How does an iPad look like? And then what are they called? So that's the perceptual memory. The third one is episodic memory, which consists of memory when things happen. So for example, where did you go to school? Where did you meet this person? Where did you eat this meal? So places are stored in the episodic memory. The fourth one is semantic memory, and that is information, facts that you have learned in. So glossaries, information that you studied in school, in university, or any other place, facts about diverse things. So geography, where is the capital of this country? So those memories are stored in the semantic memory. And the semantic memory is very difficult for the dementia to get hold to, so most of the time you have the semantic memory intact during a dementia. Dementia is affected in 2 areas of the memory: the working memory and then the episodic memory. To describe a little bit more about dementia, it will take a lot of time, because dementia is a sickness with very different types of dementia sorts. So you have, for example, Alzheimer's dementia. You have frontotemporal lobe dementia, Lewy bodies dementia, vascular dementia, pseudo dementia, to name a few. And you have much more subgroups of those types as well. The most common type of dementia is Alzheimer's dementia. So I thought of this bit of information about that, so that you know when your relative starts to get developments, so that you don't get afraid regarding it. There are different stages in the Alzheimer's dementia, which I thought of discussing with you. Alzheimer's dementia constitutes of about 60 to 70% of all types of dementia. So it is the majority of dementia types, and it affects your frontal lobe and your parietal lobe in the brain, and it most often affects the working memory, as I mentioned earlier. There are 4 stages in Alzheimer's dementia, and the first stage is where the person starts to get tired, not like the normal one, but a little bit more tired all the time, and starts to forget things in the working memory. So you start to forget where you put stuff, or if you put on the cook or not, you lock the door or not. So small things, but in a lot of areas start to happen. It is in this stage that you often can give some medicine to break or to stop the downward spiral of the dementia. And if you give the medicine, then you can stay in this stage for a longer time, compared to if you don't give any medicine, then you start to go in a faster downward curve down. So if you give the medicine, you can get the curve. If it is like this, the dementia, you can get a curve that is a slight bit upwards, but you can't stop dementia. So that's very important for you to understand. So the second stage is where you start to get difficulty in orientating yourself. So they have difficulty to adjust themselves in new environments. So for example, if they move to a new place, new apartment, or new retire home, or if they can't move to your house, they tend to get more confused, difficulties in orientating. Okay, where should I go? Where is the room? Where's the bathroom, for example? And you start to maybe think like, okay, grandma, why are you acting so weird? I mean, you could orientate yourself. You were normal in your own house. Why are you acting so weird here? And the reason this happens is that when the person was in his or her own house, they have a lot of memory that is long-term memory. They know where things are, they know how the rooms are, so they don't need to get new information or store new information to orientate themselves. They can use the memory that is already in their brain. These nerve networks, a lot of those networks are still intact regarding where things are, how the rooms are, how the house is, the garden is, or the village is. So if you take that person from that stable situation and move them to another place, then they have to learn a lot of new things. And it is precisely this process that they don't have, they can't learn as easily as a normal person or a little elderly person with MCI. The reason why they're acting weird is because it is so much information for them to take in and to learn to know, okay, the bathroom is, you must go to the right and then take some steps and then you see the bathroom. That is very difficult for them. When people with dementia are moved to another location, they normally tend to get very confused in the beginning. And also they start to get difficulty with their hygiene. They forget to bath, they forget to know how to brush their teeth. They don't want to take care of their hygiene also, so that drive to do it starts to deplete, start to get difficulty in speaking, to express themselves. So this is the second stage of dementia. Okay, if that patient comes to that stage, if you put in medicine, you can't go upwards, you can only stop in that place for a little longer time. And then the third stage is they start to get bedridden. They start to have difficulty in controlling their bowel system or their urinary system. So they start to get leakage. And in the fourth stage, they can't do anything at all. They need all of the help for them to take care of their hygiene, to feed them. So they are totally bedridden and can't do a thing. And that's the last stage of a dementia. And most often, the patient tends to die due to urinary tract infection or a pneumonia, because they are often bedridden or because they have difficulty in taking care of the hygiene. During stages 1 to 3, there's a condition called BPSD, behavioral and psychological symptoms of dementia, and it tends to most often occur during stage 2. And this is a condition where the brain starts to get difficulty in understanding what the senses are, the input that you get, how to process them, because the brain has severely damaged due to the sickness. So the brain has difficulty in understanding, okay, what do you see? How can you decipher the information that you get in? So everything that you see, you hear, you start to have difficulty in understanding them. And also how to behave is also affected. So for example, a person who is very kind and so can instantly get very aggressive or behave in a very rude way, say bad words. It's because this system, the control system, doesn't work in them. For example, normally in a normal person, we also tend to get nerve signals to either behave in a rude way or bad way or in a good way. So we unconsciously start to we decide which way we want to be or we want to behave. But in patients with the BPSD, they can't select it, they don't have the capability of it, so they tend to either be the good one or the bad one, and that can differentiate during the whole period also. So one time they're very good, so one time they're very bad, and it's a normal BPSD condition. The senses are also get affected, as I mentioned earlier. So the input that you get I mean from what you see or what you hear, they are not connected into the correct area. So what you see is not connected into your brain that it is. Say if you see a ball, it's not correct that it's a ball because it is damaged in between. So the person with the BPSD can understand a ball as a square or as a person or a dog, or when you see a person that's a square. So that connection doesn't work correctly, or what you hear, you can't decipher if it is a male's voice, whose voice it is. I mean, if a dementia person starts to see his son as a servant, it will affect the person a lot, specifically the son. Then you can't say to the father that, okay, father, can you help me? They will just say, okay, what are you talking about? Why are you calling me father? I'm not your father, you are my servant. And people also tend to think that things are stolen because they don't remember where they put something. They think that okay, they are still small, that they are very young and they are in their parents' house and they're waiting for their parents to bring supper. So their reality is very confused due to this BPSD condition. So most of the time, BPSDs get worse when the environment of the patient is moved or changed. So if you move the patient with the dementia from one room to another room, they get this BPSD condition. Or if the environment is very loudy, or if the patient doesn't have anything to do, it's very calm, it is very boring, there's a lot of noises, a lot of sound, as I mentioned. And in periods where the person will come and help them to put on the clothes, they can get aggravated, or bath them, or when they are supposed to go to the toilet, to the bathroom. Those situations can tend to the worsening of a BPSD condition. But sometimes you need to do this. I mean, the hygiene things you need to do. Researchers have shown that the most common reason to why you get dementia is because you get old. So that's the only risk factor that you have, and we can't do anything for it. And we all want to live a long life and enjoy the things what the Lord has given us, right? So what can we do to decrease the risk of getting dementia? Number one is to have a normal health. So normal blood pressure, normal weight, normal blood sugar to start with. The other thing is to have a good social network, that you have a lot of people that you interact with, have a good relation with your family, relatives, friends. You start to learn new things all the time. So don't just say, okay, now you're 50 or 60, you got the pension, so now you just to relax and do nothing. Rather, when you get time, start to learn new things, learn a new instrument. Even though you're 50 or 60 years old, start to learn a new dish, and start to exercise your brain all the time. To learn, how do you exercise the brain? You learn new things. That's the way that you build new connections, so that the brain has a lot of connections. And if you get a dementia, is a lot of the connections need to be reduced for you to get the symptoms of it. If you don't use your brain, the brain starts to think, okay, I don't need to use the brain, so then let's start to degrade it. And that's what happens when you have a dementia. A dementia is a process when that process goes much faster. Hope you got a little bit of information regarding this condition, dementia, specifically Alzheimer's dementia. And if you have any questions, or if you have any symptoms of this condition, I would like you to take contact with your general practitioner as fast as possible, so you get the correct treatment. For there are a lot of other types of sicknesses as well that tend to have the similar types of symptoms. So it is very important that you take contact with the general practitioner for it. And hope you enjoyed this video, and until next time, have a blessed